Welcome. This module will help you better understand the effects of aquatic therapy on balance and gait. This module will get your feet wet in the world of aquatic therapy PT. We will learn how to use water to increase static balance, dynamic balance, and functional skills. My name is Leah, and I will be co-presenting with my fellow colleague, Michael Wilkins. We want to give a shout out to our school, Murphy Deming, located in Fishersville, VA, in the heart of Shenandoah Valley.
There are 5 modules in this series. You're encouraged to take a look at the other modules. The properties of water and the effects of immersion on the body, aerobic endurance and anaerobic training in the water, resistance training in the water, aquatic stretching and bodywork, balance, gait, and function in the aquatic environment.
Before we get started, we would like to introduce ourselves. Mike and I have been colleagues for the last few years and have varying backgrounds that drew us to PT. We bonded as he taught me how to swim. I promise I won't drown anymore. I have fondness for creatures of all sorts as long as they don't creep or crawl, but I'm also allergic to creatures of all sorts. I know it's unfortunate, but that's what Benadryl is for. Mike is married to his wonderful wife, Eliza, who's a volcanologist and entrepreneur. They have the cutest puppy in the world, Callie. They enjoy hikes together and love being active participants in this community. Now that you know more about us, let's jump in.
After completing the aquatics resistance training module, the student will be able to describe how to utilize the aquatic environment to challenge static balance, describe how to utilize the aquatic environment to challenge dynamic balance, describe how to utilize the aquatic environments to challenge functional skills, identify how to utilize the aquatic environment to treat pathologic gait, and students will be able to identify at least 3 ways to adapt exercises to address impairments. What we are doing is training the brain. We are working on proprioception, timing, control, and motor planning. All these components help you to train the brain. But ultimately, what's most important is to practice, practice, practice. In other modules in this course, we use the FIT-VP model to prescribe appropriate amounts of exercise. However, there are no FIT-VP guidelines for balance, gait, or function. Current research says to do a high volume of repetition for improvement. So as always, practice, practice, practice.
In order to master any skills, repetitions is key. This is required in order for your brain to be able to identify the skill and also perfect it. In order to maintain safety, it is important to monitor each of these factors: pain, quality, function, and tolerance.
So first, we'll start with static balance. So the definition of static balance is the ability to maintain postural stability and orientation with the center of mass over the base of support and the body at rest. Some aspects of the aquatic environment will impact balance, including the incline of the pool, accessibility, and the dynamic quality of water. Most pools have a shallow end and a deep end that often start around 3 feet deep and can reach 6 feet or greater. Many pools are equipped with ramps or mechanical chairlifts to help patients and therapists access the pool. The ramps are especially beneficial for the pediatric population. For those younger children who are learning to walk, therapists can use a zero-depth entry pool to help them weight bear and improve proprioception while making therapy fun and enjoyable. There are many ways to challenge static balance. Here are a few. You can do it in sitting or a variety of poses in standing. Static balance is important to work on because it is essential for stability and dynamic movements. This is why when we begin to rehab a patient, the typical progression is to work on static balance, then move on to dynamic.
Here is a list of static balance progressions. In the following slide, we will go into greater detail about all of these. We can start an individual in double limb stance. Once they're able to complete that, you can progress into staggered stance. To increase the difficulty even more, you can have them complete a single leg stance. Following this, you can progress into static balance with aquatic perturbations, aka waves. These waves can either be created by you or someone who is assisting you. In addition, you can change the intensity of the activity by asking your patient to perform it with their eyes closed. This can apply to any and all of these activities.
Here is a suggested progression. You can start by asking your patient to sit in a chair. You can follow this up by asking them to stand in double limb stance on a stable surface. If they're able to perform a double limb stance with good balance, you can progress them to a staggered stance or tandem stance, depending on tolerance level. Once they are able to complete the activity without support, you can progress them to a single limb stance without support. In order to make these activities more challenging, you can insert a wall sit on the side of the pool. These activities targets lower extremity, core, and cognition. If you want to even make it harder, you can make the task a dual task. Here we have a land demonstration of the progression that you would be doing underwater. We are working on static balance, and the patient may not be able to weight bear on land, but they can do this underwater to compensate for that. You would also do this underwater as if the patient has an impairment that is limiting them from being mobile on land. It's all well and good to say we want to work on static balance, but how do we do that in the water? We showed you an example of this progression on land in the previous slide. This is the same progression that we would do in water. An easy way to challenge that static balance is to send waves or perturbations toward the patient. The wave's impact on the body is hard to predict and forces the patient to compensate. The water also allows us to adjust the exercise to fit to the patient's capabilities. If it is too hard, they can move to deep water so more of their weight is supported. If it needs to be more difficult, they can move to shallower water or have increasing strength of perturbations. To further challenge a person's static balance, you can change the buoyancy of their bodies in symmetrical or asymmetrical ways. Weights can be used to increase stability, while floats can be used to decrease stability. Either option can be used to change the normal distribution of balance. Lastly, most things are harder with eyes closed, so why not train that way if eyes open has become too easy? By taking away vision, a person has to rely on and improve the response of their vestibular and proprioceptive systems.
The following videos show you perturbations from multiple directions. The first video shows perturbations while in double limb stance. The second video shows double limb stance with sideways perturbations. The third video is a progression of forward perturbations with single limb stance. Next, we will be diving into dynamic balance. Dynamic balance is a process by which we control the body's center of mass with respect to the base of support, whether it's stationary or moving. Your body is less stable when performing dynamic movements. As an individual performs dynamic movements in water, there are a number of elements we can use to make it harder. Some of these elements include the depth of the pool, the incline of the pool, and introduction of additional weights and obstacles that they have to navigate. Dynamic balance is involved in any controlled motion. These motions can be as simple as walking from the couch to the bathroom, or as complex as performing an interpretive dance. Without dynamic balance, many of our functional activities would not be possible. When a person has poor dynamic balance, we help them compensate with adaptive devices or by making the task easier. However, we prefer to challenge them when possible. Some of these options include gravity-limiting dynamic devices and physical therapy interventions.
We challenge dynamic balance in all the same ways we challenge static balance. However, with dynamic balance, we are adding movement and resistance to that movement in the form of weights or drag in the water. Alright, let's go through this list. We can start with some weight shifts at varying depths, having eyes opened or closed, and adding different weights to the limbs. Progress to reaching outside the limits of stability, and eventually add in reaching overhead. Once the individual is able to move outside the limits of stability, they can work on stepping onto and over curbs. Progress from single curbs to multiple curbs, aka stairs, using the pool stairs or steps of varying heights. We will discuss dynamic gait and its role in pathological gait later on in this video using an obstacle course.
The following videos show 3 progressions that you can use to challenge an individual's strength and limits of stability. These exercises mimic functional activities that your patients will be doing at their home, workplace, and during social activities. For example, a sit-to-stand mimics getting on and off a couch, and weight shifts can be progressed to walking. Finally, a forward reach challenges your limits of stability, and this can mimic reaching forward for different items that may be in your kitchen.
These are the same progressions from the previous slide, but underwater for you. First here we have sit-to-stands. As you can see, you do not need a chair underwater. You can use the stairs inside of the pool. Next, you have weight shifts. Lastly, you have forward reach. These exercises are very beneficial for someone who has difficulties weight bearing on land, and they need the extra support underwater when they're doing these activities.
In these two videos, we're using a step to demonstrate stair and curb navigation. In the first video, a step is used as a means to step up and step down. You can do this either in one direction or both. In the second video, you progress from a step up, step down into a four-way stair navigation. With this demonstration, you can see you can go in all four directions while using the resistance of water to help you. If the individual is able to complete the exercise in the previous slide, they are ready to progress to using a full set of stairs. You can find these in most schools.
The first video shows an individual walking underwater with weights on. The weights add an element of resistance that helps to strengthen the lower extremity while giving them additional feedback as to where their limbs are. The second video shows an individual running underwater. This is a high-level activity that you can use with athletes or individuals who are looking to get back to running as a sport or recreational activity.
Okay, let's freestyle into functional gait. By functional gait, we are talking about a gait pattern that allows a person to get from point A to point B using the least amount of energy possible. To do this, you need to have a balanced energy expenditure and the ability to control that walking forward.
A neurotypical gait is a repetitive gait sequence that allows an individual to transition from point A to point B. This picture shows you a normal gait cycle. Here is a video of me walking for comparison. In your training, you will likely study neurotypical gait. Use this slide as a basic refresher. Okay, let's paddle through the problems with gait.
As noted in Stanford Medicine, there are 8 basic pathological gaits. They include hemiplegic, spastic diplegic, neuropathic, myopathic, Parkinsonian, choreiform, ataxic cerebellar, and sensory. Some examples of pathological gait that you may see in the clinic or out in your community include extension thrust, flexed posture, and extended posture. They can be diagnosis specific and may differ from person to person. We have provided you with some examples of pathological gait that we will encounter later while making this module. Here are some of the reasons that makes practicing gait in water different than on land. Buoyancy offloads the joints and makes movement easier. Water viscosity provides resistance. Water depth can be changed to increase or decrease difficulty. Water perturbations can be used to challenge balance. You can also slow the motion down to help you observe impairments clearly. To be noted, there are times when buoyancy changes proprioception to the extent that it is not comfortable for the patient, and therefore underwater gait may not be beneficial for all. Here we have our volunteer, Mr. Jones. In the following videos, you can see foot drop underwater and on land. If you carefully observe his right foot, you can see it. Here are 2 more videos of him walking underwater. Both of these videos show that it's easier to see impairments underwater. Mr. Jones also reported that his feet felt more steady while walking in the water, and he felt more stable. On this slide are some of the tools we use to address gait deviations that we saw in our patient. You can use weighted belts, ankle weights, flotation devices, and pull noodles to make an obstacle course harder. You can also progress the obstacle course intensity by changing the depth of the water. But the most important part of addressing pathological gait is patient education.
So, you've convinced your patient that water therapy will help their gait. Now, how do we improve it? There are a variety of exercises that you can do. First, have the patient march in place. Then, progress to four-way gait, as this is necessary for crowded and busy environments. Make sure that the patient is taking long enough strides. As we age, we often take slower and shorter steps. To retrain this, we can use targets for patients to step on or to. This can be paired with a metronome to increase the steps per minute they are taking and increase the walking speed. One thing you should have the patient do is count the number of steps it takes to cover a certain distance, such as the distance between one side of the pool and the other. When they're practicing on their own, the goal will be to take fewer steps than this to cover that same distance to ensure that they are taking long enough steps. Pathological gait is often present in the cerebral palsy population. With someone who has unilateral hemiplegia, you can challenge them by either unweighting the unaffected limb or weighting the affected limb. Unweighting the unimpaired limb encourages the individual to use their impaired limb more. Weighting of the impaired limb helps promote whole foot contact, decreases incidence of toe walking, and increases stability by adding sensory stimulus to compensate for lack of proprioception. These three videos show an individual with cerebral palsy walking on both land and water. Take a moment to view the videos and see if you can identify the affected limb. If you decided it was the right side, you'd be correct. These two videos show how the gait of a person with cerebral palsy can be changed by adding a weight to the affected side or a foot to the unaffected side. The video on the left shows a person with the weight on the affected limb. The video on the right has a flotation device on the unaffected limb. The flotation encourages weight shift onto the right side. By the way, it's important to put equipment on correctly so they don't fall apart in the middle of a video. These two videos are of the same patient on land and underwater. Underwater, he demonstrates more midfoot contact while wearing a weight, while on land, he demonstrates toe walking. Now, we're not saying that this will work for every patient, as the addition of a weight will impact every person differently. On land, he doesn't achieve terminal knee extension or toe off. However, in the water, he is able to achieve full knee extension and toe off. He reported that he also felt more comfortable walking in water than on land with the addition of the weight. The functional environment can vary depending on an individual's activity preferences, occupation, house and community environment, and transitional environments. Functional skills are a combination of static and dynamic components working together to help us get moving and stay moving. In order for you to have typical gait and balance, your cardiovascular, musculoskeletal, and neurologic systems have to work in sync with each other. When one of these systems has been impaired, an individual's ability to complete functional tasks is negatively impacted. Some examples of functional skills are walking, doing laundry, or dual tasking. Higher level functional skills could be running or jumping, such as in this video. Practicing these skills underwater allows for a patient to safely learn how to react to an impact.
Next, let's float into functional skills progression. Once your patient is able to perform static and dynamic exercises without pain, loss of function, and good quality of movement, you can progress them to doing functional exercises. A good starting point is performing sit-to-stands. This transitional movement can be adapted to the individual's level of disability and progress until they are able to stand up by themselves. Next, we can work on moving out of their limits of stability. This can be achieved through overhead motions that are outside their base of support. You can introduce objects of varying shapes and weights to mimic silverware, plates, cups, and other household items.
Next, we can work on underwater gait at varying speeds. For this, we can use the rate of perceived exertion, or RPE scale, that's rated from 0 to 10 to determine intensity. Start them at an intensity of 3, then increase to 5, and eventually 7. This scale is adaptable to each individual and is used by therapists when they can't rely on heart rate or blood pressure due to medications or because you can't bring the equipment into the water. From here, you can progress to navigating curbs, obstacles, and stairs to mimic the environment patients have to navigate to be active participants in the home, work, and social environment. This can be done at multiple depths and with the use of varying weights to mimic the effects of gravity. To increase the difficulty of the activity, combine all of these activities into an obstacle course that mimics different settings, such as the grocery store, the living room, or a work environment. Other possibilities for exercises could be sit-to-stands, or step-downs or step-ups, with the stair or the chair weighted down for stability. This slide shows our Dynamic Aquatic Activity course, or DAC. I know it's not in the water, but we removed it from the water to give you a better view of what it might look like. We start with step-ups in all directions, then rows with the therapist holding the resistance band, onto forward reach, and then sit-to-stands. These videos are of me doing the activity course. These videos are also of me having a little bit of fun while doing the exercise course, of course.
Alex is a 24-year-old male with right-sided hemiplegia. His goal is to reduce spasticity and normalize gait on land. What might you do with him in the water to facilitate this? Pause to decide what you might do with him in the water. As we talked about before, a patient who has cerebral palsy, you can add weights to the affected side or floats to the unaffected side and have them walk and perform tasks in the water to normalize movement. In addition, a warm water pool can help to reduce his spasticity. Eli is a 3-year-old child with cerebral palsy. The goal for therapy is to increase static balance in sitting, standing, and kneeling. What might you do with him in the water to accomplish this goal? Pause to decide what you want to do with him. You can play games with Eli at the side of the pool as he sits, stands, or kneels on a step. As he becomes more accomplished with this, you can raise him out of the water so he is supporting more of his own body weight. Evan is a 78-year-old male with foot drop. The goal for therapy is to maintain muscle endurance. What might you do with him in the water to accomplish this goal? Take a minute to pause and think of what you'd do. Have Evan begin a regular aquatic workout. This should include walking at different speeds with a focus on heel-to-toe walking. As he becomes more tired, he should slow his speed to focus on proper form. Be sure to have him perform stair climbing as well. This case study demonstrates the dramatic impact that having someone working in the water can have on their ability. Ms. Pond has chronic hemiplegia and is overweight. At home, she spends most of her time in her wheelchair and is not able to walk household distances safely or independently. In order for her to be safe when she's standing on land, she needs standby or contact guard assist. She needs to use her strong arm for assistance with balance. Based on this presentation, she is not a safe community ambulator. In the water, she is able to walk by herself with the assistance of an ankle weight. You can see it on her right ankle, and a floating barbell for balance. The benefits are that she is able to stand independently, she's able to water walk for 10 minutes, and does not require constant supervision. The water properties that we're using for this case include buoyancy, hydrostatic pressure, which increases the cardiac output and increases the fluid going into her lymphatic system.
In conclusion, we hope this has been informing and challenging for you. Aquatic therapy is a subset of physical therapy that continues to grow as demand for its use increases. This may be a viable option for your future and current patients. Thank you for sticking with us to this point. Signing off, Leah and Mike.